Hello everyone. This mini lecture is on Xia Hou Po Tang, also known as Pioneer and Magnolia Bark decoction. The formula is from the Cal formula list. I will summarize the pattern, a short patient case, 3 clinically important drug-herb interactions, and a practical management plan. Traditional use. Xia Hou Po Tang belongs to the category move qi, or transform phlegm, or plum pit qi. The formula is selected by pattern, not just by disease name. In this presentation, the goal is not to prove that herbs replace medication. The goal is to show how a practitioner thinks about benefit, risk, and communication with the patient's physician. Case patient. 52-year-old female with globus sensation, anxiety, reflux, and insomnia. Medicines. Omeprazole, alprazolam as needed, and aspirin 81 mg. The pattern diagnosis is phlegm qi stagnation in the throat. Tongue slightly greasy coat. Pulse wiry slippery. This gives a reason to consider the formula, but it also creates the need to check her or his medication list before recommending treatment. Interaction 1. Hou Po and sedatives. Mechanism. Magnolia bark constituents may have calming effects. Combine cautiously with benzodiazepines. Clinical significance. Moderate. Watch sedation, falls, and impaired driving. Management. Identify high-risk patients, avoid duplicate herbs, and monitor symptoms and objective values when relevant. Interaction 2. Shenjiang and aspirin. Mechanism. Ginger may inhibit platelet aggregation and may increase bleeding risk with antiplatelet drugs. Clinical significance. Low to moderate, higher with other NSAIDs or GI ulcers. Management. Counsel the patient on warning signs and coordinate with the prescribing clinician if the medication has a narrow safety margin. Interaction 3. Xia quality issue. Mechanism. Raw or improperly processed pioneer is irritating and toxic. Product quality matters. Clinical significance. High if product is not properly prepared. This interaction may be less certain than the first one, but uncertainty is still important because patient safety comes first. Management plan. Use prepared Xia only from a reputable supplier, separate from omeprazole if GI irritation occurs. Monitor sedation and bleeding, and refer for dysphagia or weight loss. I would also document the formula, dose, product brand, start date, stop date, and all current medications. If red flags appear, the formula should be stopped, and the patient should contact the physician. Conclusion. Xia Hou Po Tang may be useful when the pattern fits, but the safest clinical approach is a short monitored trial, clear patient education, and communication with the physician and pharmacist. Thank you.